welcome to Colores Latinos TV. I'm Nancy Peña. As you know, Colores Latino TV is a monthly and bilingual show that brings to you important topics such as health, education, and culture. Today we are going to continue to discussing about understanding substance use as illness and safe injection facilities with Dr. Steve Defese. In our first episode, we were discussing about how to prevent to have this issue we are having right now about drugs abuse, and also we were talking about what is the safe injection facility. And I just want to welcome again Dr. Steve Defese. Thank you so much for being with us.
It's a pleasure to be here with you, Nancy.
Thank you. So in our first episode, we were discussing about how important it is to prevent, not to become a patient to addict to substance use.
Mm-hmm.
So I just would like to ask you again, just to refresh to our audience, what is an addiction and how we can prevent that?
Sure. Well, an addiction is a compulsive use of a substance or behavior that's sort of out of control of the individual. And we know now that addiction to heroin or opioids more generally, narcotics more generally, is a physical disease of the brain. There's actually portions of the brain, deep within the brain, related to the pleasure center, reward center, motivation center, and there's diseases of these areas in the brain, changes, chronic physical changes in the brain, just like a broken bone is a medical illness. Substance use disorder and addiction is a medical illness. And just like we have cures for broken bones, we have treatments and cures for the chronic medical condition of opioid substance use disorder.
Thank you, doctor. Also, I remember that in our first episode, you were illustrating to us a couple examples of how sometimes people become a patient to addiction because they start to use some pain relievers. So could you please just illustrate to us one of those examples again?
Sure. Well, there are lots of examples of people who were prescribed pain medication because it was necessary. Mm-hmm. But some percentage of us are genetically predisposed to become addicted to those medications. And others of us can take those medications and not enjoy them and not become addicted. But lots of people that have burns, severe burns, are in severe pain for long periods of time and require opioids. And some of those people can become addicted. Lots of people with severe trauma, that it takes an extended period of time to recovery from, broken bones, motor vehicle accidents, etc., are treated with opioids, and some percentage of them never get off opioids. There was a recent study this past year in one hospital where they looked at patients who had never been on opioids before who went into surgery. And then 6 months later, they saw how many people were still on opioids, and 6% of the people were still on opioids months after the surgery. And there's no reason for them to be in pain months after the surgery. So what this tells us is that a certain percentage of people who are undergoing routine surgery, whether it's a Syrian section, total hip replacement, etc., a certain percentage of them end up addicted to medication because they were exposed to it and probably given doses that were too high and for too long.
What are for example, the pharmaceutical industry and the doctors, what they are trying to do to fix this issue, at least with legal drugs?
Yeah. Well, now we've recognized that this is a crisis. All these people, 91 people a day are dying of opioid overdoses. Some of them are dying from medications they take in their home that their doctors prescribe to them. Some of them are dying from illegal use of drugs such as heroin, and now heroin laced with these terribly toxic fentanyl. We have come to recognize the magnitude of this public health crisis. And now lots of people are working together to help fix it. And there's sort of two fixes. One is to treat the people who have full-blown substance use disorder compassionately and with science to help them avoid going into withdrawal with medication-assisted therapy. And then the other sort of prong, just as important, is to try to stop the next generation of people from becoming addicted to opioid use disorder, which means we have to prescribe a lot less of these pills to patients and have a lot less left over when patients are done using them for their illnesses. And then when these drugs are in their homes and they're better, their bones are healed, patients have to be educated to get these things that are as dangerous as loaded handguns out of their homes, either through drug take-back or in the garbage or just flushing them down the toilet. So there's a variety of organizations here in the state of Massachusetts that have been doing, really sort of great work to help along all these fronts. The Massachusetts Health and Hospital Association, for example, came out with guidelines first for the emergency rooms of every hospital in the state, and then for hospital-wide guidelines that affect not just the emergency room, but every department in the hospital, including orthopedics and outpatient physicians as well. And these guidelines are really best practices that were disseminated to help doctors know when to prescribe narcotics, when to try alternatives to narcotics, how to protect women and babies who might be exposed to substances or have full-blown substance use disorder. The Massachusetts Medical Society, which represents a big percentage of the doctors in the state, have come up with their own education programs to educate doctors. Doctors, you may know, need to take a certain number of continuing medical education credits every year to be sort of up to date. And now, the Massachusetts Medical Society, which typically sells their education courses, gives all of their opioid education courses for free to doctors, and not just doctors, anyone who's got a license to prescribe medication, whether it's a physician assistant or a nurse,
psychiatrist.
Everybody who can prescribe can get these education courses at the Massachusetts Medical Society for free. Above and beyond that, the Massachusetts Medical Society and the Massachusetts Health and Hospital Association have worked together to develop uniform curriculums to train medical students and to train dental students, and interestingly enough, even veterinary students prescribe narcotics for their patients. And so we've got the first state in the nation to have a uniform curriculum to train people on the dangers, the risks, and the benefits of these medications. And this uniform curriculum was put together with collaboration between these two organizations as well as other organizations in the Department of Public Health. After that was accomplished, we became the first state in the nation to embrace a uniform curriculum or training for the prescription of pain medication, these dangerous, pain pills, for people after they graduate medical school. Because as you know, when doctors graduate medical school, they next do internships and residencies before they're sort of fully trained and licensed and out in the community. So during their internship and residencies, we're the first state in the country to have a uniform and thorough curriculum to train people about the risks and benefits and dangers of these medications.
Excellent. How about education for patients? What we are doing in terms of educating people, we discussed that in our first episode, that when we are going for a surgery or after surgery, we are being prescribed narcotics. So how we can educate our audience, regular people like me, or people who are watching this episode right now, how we can have that conversation with our doctor, what we should ask the pharmacy?
Well, the medications we're talking about are all pain medications. So I'd encourage everybody, if your doctor's given you a prescription for a pain medication, to ask, is this a narcotic? Is this a medication which could lead to addiction? Some prescription pain medications are narcotics, like codeine and morphine and OxyContin. Some pain medications are not narcotics, like Motrin and aspirin and Tylenol. You can certainly, if you know that you're predisposed to becoming addicted to these substances, perhaps you're somebody who's an alcoholic in recovery, you can say to your doctor, I know I have a high risk for these medications that are addictive. Can you prescribe alternative treatments, physical therapy, massage therapy, non-narcotic pain relievers? And then again, I just mentioned that when the Massachusetts Medical Society and the Massachusetts Health and Hospital Association came together to fight this crisis, one of the things we did is come up with a patient education sheet that talks about the risks and the benefits and how to dispose of this medication. And these patient information sheets are available, and if your doctor does not have them in their office, they can get them from us either at the Massachusetts Health and Hospital Association or the Massachusetts Medical Society. And we've had these educational, it's a one-page, it's very easy to understand, it's written in layman's terms, and these sheets are also available in Spanish and in Portuguese, and we're working to get them translated into other languages as well.
Okay, great. I read that in your article, Dead Patients Can't Recover. So in that article, you describe and talk more about why we need safe injection facilities. And I would like to ask you why we need safe injection facilities, and if that is okay for our society, and if we can prevent more, people deaths having this program. But Dr. Defosay is going to answer that question after this pause.
Taxi!
Si no puedes hacerlo todo, haz lo que puedas. La compasión por los demás, pásala. Un mensaje de la Fundación para una Vida Mejor.
Hello and welcome to Colores Latinos TV. If you just turn around your TV, we are discussing with Dr. Steve Defosay today about what is the importance of having safe injection facilities for the crisis we are living and facing nationwide, day to day, about substance abuse. Again, Doctor, welcome to the show. And my question was that why we need safe injection facilities?
Well, I'll tell you, Nancy, why I'm in support of these facilities. Some people call them safe injection facilities. Some people call them supervised injection facilities. Some people have more recently called them overdose prevention centers. Mm-hmm. And I think that name sort of helps us understand what these are all about. But before I go there, let me just mention that while we're trying to stop a new generation of people from becoming addicted to opioids by educating the public and physicians about the dangers of narcotic pain relievers and trying to use the least amount of these as possible and getting people to dispose of them in their homes when they're done with them, and we're also trying to help people with the medical condition of substance use disorder enter recovery, where they can use medication-assisted therapy to help fight off the terrible pains of withdrawal, rather than using, injection of illegal medications, illegal drugs in their arms to fight off, the syndrome of withdrawal. Not everyone who has opioid substance use disorder, who's addicted to heroin, is ready to choose recovery. But that doesn't mean that we can't help them. If somebody who is not ready to choose recovery still wants to inject a drug, wouldn't it be better if they inject a drug with a clean needle as opposed to a needle with hepatitis? Wouldn't it be better if they're injecting the heroin with a clean needle rather than a needle that has HIV or AIDS? Wouldn't it be better if they learned how to clean their skin so that when they inject compulsively because of this disease which affects their brain, they don't inject bacteria into their bloodstream, which results in a blood infection and a heart infection and $100,000 admission to a hospital and maybe even open heart surgery? Wouldn't it be better if we could protect them from all these things? Wouldn't it be better if they inject the medication, the heroin rather, in their arm and they overdose? Wouldn't it be better if somebody was there to give them an antidote so they could wake up, as opposed to die and go to a funeral? And these people aren't, isolated from society. These people that are dying, 91 people a day dying from heroin overdoses, they're our brothers, they're our sisters, they're our mothers and fathers, our grandparents, our children. Every one of these people, in addition to being a statistic, is a terrible tragedy for their family. So the idea that you can open up a center so that people who want to start becoming more healthy, and the first step is to limit the harm that they're doing to themselves, wouldn't it be great if they could inject in a way that was safer by having medical trained people explain to them how not to contract viral diseases, how not to get bacteria injected into their blood? And if they overdose, wouldn't the mothers of those 91 people who die a day wish they had overdosed in a safe injection facility where they could have been revived, and then maybe that episode might even be the stimulus to have them choose recovery? The way these supervised injection facilities work, the patients come in, they're screened. These are not like bars where people can go buy alcohol. Mm-hmm. There's no drugs being sold, and the only people who are allowed to use them are people with chronic heroin use. They come in, they're screened, they're supervised on how to inject their heroin safely, and oh, by the way, because they're in this facility, now the Department of Public Health can take microscopic samples of this stuff they're injecting, so we can actually learn from a public health point of view, what's on the street? Is it just heroin? Is it concentrated heroin? Is it fentanyl, which is 50 times more concentrated than heroin? Is it carfentanil, which is fentanyl developed for elephants, which is 5,000 times more dangerous than heroin, which kills people a dozen at a time in our cities? So they inject this. They're supervised while they're, for a period of time until they're safe to leave, and then they leave. And while they're in the facility, they're offered basic medical care. If they have wounds or infections, they can be treated. But just as importantly, they're told that there's another way to stave off withdrawal, which is medication-assisted therapy. These people, every time they come into the building, they're touched by the healthcare community to say, we care about you, we have an alternative therapy for you, and that therapy is available, and we can help you take that instead of taking heroin. And in Vancouver, Canada, where one of these facilities has been operating for a number of years, 35% more people, the death rate of overdose in that area has been reduced by 35%, so 35% of the mothers in that area didn't lose their children. And the uptake for medication-assisted therapy, where people leave heroin altogether and enter recovery, was 30% higher once that facility was opened. So not only does it reduce the harm of these people, but it does in fact get more people into treatment and into long-term recovery.
So if I understand well, you mentioned at the beginning that these facilities are going to help just for people who are consuming heroin, no other drugs, like cocaine and other drugs that perhaps I don't have in my mind, because honestly I'm not familiar with the topic, and that's what I'm here learning.
No, I don't know the answer to that, to be honest with you.
Okay. But for now, it's for
what I'm familiar with is that these facilities are used. There's over 100 of them worldwide. There's none that are legal in America, because right now they're illegal.
Yes.
But more than 100 of them worldwide, treat people and reduce harm for heroin use.
So one of the, not one, but many benefits that you mentioned here is that if we agree and we support to have the safe injection facility in the United States and in Massachusetts and other states, we are, the benefits is not just for people who are unfortunately being patients to addicted to opiates, for them not to have like an overdose. So we are having medicals, we are having doctors, nurses in those facilities, correct? And also we are trying to avoid for those patients to have infections through the needles, right, in injections, and also our community, because sometimes, for example, I remember a year ago I went to the mall and I was trying to use, the bathroom with the kids, and the bathroom was closed, and I asked the manager if we can use the bathroom. They said the bathroom was closed because somebody has an overdose, died in this bathroom. So now the bathroom was under investigation, and they were more, aware that people who go to the bathroom, any bathroom, coffee shops, they are using those facilities or those, rooms to get the injections, so to use the drugs.
That's another. I'm sorry, I didn't mean to cut you off.
No, you can go ahead.
I was going to say that's another advantage of supervised injection facilities or safe injection facilities in a neighborhood. Where they've been opened, people tend to inject their drugs inside this facility, so there's less dirty needles in the street. There's less heroin-related litter in the street. There's less or fewer people injecting these heroin in the street, so it actually improves the neighborhoods. Now, to get a supervised injection facility here in Massachusetts, we're the first state in the country where the state medical society, the Massachusetts Medical Society, endorsed this concept. We're the first state in the country where the State Hospital Association, the Massachusetts Health and Hospital Association, endorsed this concept. We both, from the Massachusetts Medical Society and the Massachusetts Health and Hospital Association, went to Beacon Hill to testify in favor of a bill to pilot a legal safe injection facility here in Massachusetts under the guidance of the Department of Public Health. And I believe that we could change the laws. The laws have to be changed to allow us to do this. Massachusetts laws need to be changed. I believe they can be changed, and there's a will to do it on Beacon Hill, because this is the #1 issue for the public, and particularly the public health in the state. But in order to do it, some neighborhood has to say, we care about our children enough, we care about our citizens enough that we want it in our neighborhood. And I think if a neighborhood comes forward, whether it's in Cambridge or Boston or Western Massachusetts, and says, we have enough people dying in our district, we want help, that will be what pushes the political will in Beacon Hill to get this law passed and Governor Baker hopefully to sign it. And so I'm asking people that are watching, if you're a church or a facility that you want to support a safe injection facility in your neighborhood, please contact me, because there's a whole bunch of grassroots organizations that are trying to bring this to the state. And one of the stumbling blocks, besides sort of public misperception that this might be bad for a community when in fact it'll be good for a community, one of the stumbling blocks is actually finding a facility where we could do this.
Now that you've mentioned that it would be bad for community or good for community, my question is, because we interview some people after this mini-series, and we are creating about how we can prevent substance use. And one of the questions I have from people from the community is like, how much it costs this? And my second question is, don't you think that if we have a safe injection facility here, in the corner we are going to have a dealer selling that drugs because people are more happy and feel that it's going to be better for them to get the substance abuse supervised here. So we are going to increase the dollars for dealers.
It's a great question, and very reasonable one for people to say, I'm not sure I want this in my neighborhood. Mm-hmm. It turns out in the neighborhoods where these exist, and one where it's been very well documented and studied in Vancouver, Canada, the amount of drug dealing on the street in the immediate area has not increased. It turns out that the number of people using drugs in the neighborhood has not increased, but those that are using them are not dying, and those who are using them are choosing increasingly to enter into recovery.
We know that, I remember that Governor Charlie Baker mentioned before, maybe a couple months ago, that, don't remember it was him or somebody else, but you maybe can correct me, mentioned something that they are trying to create 48 hours forcing recovery or something like that. You can please correct me?
Yeah, well,
it's completely different that we are talking, right?
That's completely different.
Okay.
There's a bill pending now on Beacon Hill, mm-hmm. is sort of phase 2. They did, the state has already passed one sweeping legislation or law dealing with the opioid crisis, and it's made a difference. They've got new computer systems that they've paid for so people can check on patients' past histories. It has, in fact, in the last 2 years, the number of prescriptions for opioids in the state has decreased 30%. That's about 50 million less pills in the state. So we've made progress already. There is another round of legislation circulating on Beacon Hill now with broad bipartisan support. Both Democrats and Republicans, mm-hmm. doctors and hospital associations support this. It does include one somewhat controversial component, which allows an emergency room doctor, if they feel a patient is at danger to themselves or to someone else, to involuntarily hold that person for 3 days while they try to treat them for their medical condition related to opioid substance use disorder. I'm not an expert, I'm not a politician, I don't write laws, but I think also in that bill, at least being discussed in that bill, is something else which I think would be more useful. That particular policy to hold someone against their will, put them into detox for 3 days against their will, might result in more people dying, because once someone has been in detox for 3 days, when they get out, they're going to have a lower tolerance to heroin, but they might shoot their old level of heroin into their vein and then die of an overdose from it. I'm not convinced there's any evidence in the literature to suggest that'll save lives, although it's certainly well intended. And I understand, there are mothers who say, my children died, if only somebody held them against their will for 3 days, wouldn't that have been better? Mm-hmm. There's no evidence to suggest that would be better, but it's still well-intentioned legislation. Something that I think there is evidence to suggest would be better is to offer medication-assisted therapy while the individual is in the emergency room, so they while they're going through withdrawal, they experience the relief of the withdrawal pain without drugs, without heroin, and then when they leave the hospital, to be given an appointment the next day to go to a facility where they can obtain more medication-assisted therapy to continue to stay out of withdrawal. I think if our emergency rooms routinely treated people for substance use disorder with medication to keep them from going into withdrawal and routinely gave them an appointment the next day for a particular office visit somewhere else, we could make more progress in this. I would like to answer one other question you asked about the cost of these safe injection facilities. In Vancouver, if I'm not mistaken, I believe the cost is $1.8 million a year, and that's paid for through taxes, through society. But in Vancouver, they've done estimates that say that it saves society $7.8 million a year because the safe injection facility keeps people from getting HIV/AIDS. It keeps people from getting hepatitis. It keeps people, because people are going into treatment, it keeps people from overdosing on heroin. All those things, HIV/AIDS, bacterial heart infections, hepatitis C, all very expensive to treat. If you eliminate all of that through safer practices, you eliminate the cost. And that $7.8 million would have been paid for by the same taxpayers in Canada because they pay for the health care up there.
Versus $1 million a year to save and to contribute, not just for the society, but for patients who are having these issues, right?
Yeah, I mean, the evidence is clear. This is a win-win. It's great for the patients, it's great for the community, and it's cost-effective. It costs less to operate one of these facilities than to let the people continue to inject in the parks and come in with HIV and have to treat that.
Thank you, doctor. Well, as you know, we also are very close to finish this interview. This topic is a passionate topic. It's a very controversial topic, and that's why we are creating this mini-series. So the question I have for Dr. Defasey before we finish our episode is how we can help our friends, our family members who are suffering from this disease, not from the point of a medical point of view of a doctor, but how we can become more compassionate to those patients.
Well, everything I've said up until now is backed by scientific evidence in the literature, rigorously documented. This last point, I'm just going to speak from the heart. These patients are just like you and I. They're but the grace of God. We might have had a burn injury and become addicted to these pain medications ourselves and develop this disease. And so we look at these patients as our brothers and sisters, our children, our parents, our grandparents. And if your loved one has any illness, you want to help them. And I think, letting people know we care, that we want to help, and in fact help is available, is probably the best thing we can let them know. These people are in the, every few hours they go into withdrawal and pains with withdrawal, and they do everything they can to stave off withdrawal. So I think part of the message could be we care, and there are alternatives to going through withdrawal with medication-assisted therapy. And when you're ready for it, we certainly want to support you and help you with the program. And in Massachusetts, we're fortunate that there's basically 100% coverage for health insurance, and these services are paid for. People, even if they're unemployed and don't have income, can be treated.
Thank you. So if we want to reach you out and to learn more about the safe injection facilities or perhaps other resources that are in the community, where can we contact you?
I'd be happy to respond to anyone through my website, which is defosays.com, DEFOSAYS. And there's a contact page on there. Just go ahead and send me an email, and I'll be happy to help anyone, direct them to resources. And I certainly hope that everyone watching helps their members in their community.
Thank you, doctor. So it was a pleasure to have you with us. Again, remember you're watching Colores Latinos TV. If you want to watch this interview again, you can visit us in our channel on YouTube, Colores Latinos TV. Also, you can email us if you have questions to coloreslatinostv@yahoo.com. And you can check it out on our website, www.cltvs.com. Thank you.